Hello, and welcome to Good Emote Physical Therapy's Tip of the Day. Today I'd like to talk about what you do after an injury. In the 1970s and 1980s, it was recommended to rest, ice, compress, and elevate after an injury. So it's RICE. We have since learned this was not such a good idea. Number one, resting does not help someone recover. So the R is no longer in the acronym. In fact, now it's M as in move. If you have a severe injury, gentle range of motion is still safe. The other changes are from ice. Most people think that ice will help to reduce swelling, but ice is a vasoconstrictor, which means it slows the blood flow down. So the reason ice is recommended in the beginning is to minimize how much swelling you get, but it's only good for 12 to 24 hours maximum. After that, ice is only for pain control. Ice does not reduce swelling. It minimizes it in the early stages, again, the first 12 to 24 hours. A better recommendation is to compress. Compression, like an ACE bandage or a sleeve, continues to increase the blood flow to the area while simultaneously compressing, therefore reducing the swelling. I also recommend elevation, especially with lower extremity, meaning knee, ankle, foot area. Highly recommend it. So my tip of the day is, instead of using rest, ice, compression, and elevation, switch it to movement, compression, and elevation, and use ice only in the first 24 hours for reduction of swelling, or ice for pain control. Just don't be deceived to think that ice reduces swelling. It doesn't. That's the tip of the day.